I'll pass it on to my colleague Selena to do a few introductions. And I know, Selena, you probably go through the housekeeping, so I'll pass that on to you. So thank you everyone for joining.
Thank you, Shema. Thanks everyone. If you can make sure that you're on mute when you join, just so we don't have too much background noise. Thank you. So welcome to our 6th ARC Northwest Coast Seldom Heard Forum. And I'm here with my co-organisers, Shema Hassan, who's our research lead, Nahid Tahir, who's our public advisor lead for the Seldom Heard Forum and co-chair, and Ruth Ball, who supports all our public advisors. Some more pictures of us. So just the agenda today is just slightly changed. So our first speaker, and I'm going to let them introduce themselves, will be Victor Nadaba. Second speaker, Ramadan Al-Hamroni from the Salvation Army. Our third speaker, Emma Leeper, for the National Coordinator of Action Asylum, and then we'll have a short break. Our fourth speaker is Seema Gull, one of our public advisors, talking about her lived experience. Our fifth speaker is Layla Said from Community Inclusion from Central Liverpool. Sixth speaker, Helen Stalford from the University of Liverpool, talking about unaccompanied asylum-seeking children. And then we're going to have some time for questions at the end, but please do put your questions throughout in the chat. And then we'll be finishing for 3 o'clock. So housekeeping, as I said, please remain on mute through the presentations. We are recording the forum, but I understand that this is a sensitive topic for some. So if anyone feels uncomfortable, please do have your camera off or be on mute. And if anyone feels uncomfortable about potentially the recording being kept and presented through ARC Northwest Coast, please do contact us. We could potentially edit parts of the presentations, etc., if needed. So do contact us if you've got any issues about that. Yeah, so please use the chat function throughout to make comments and ask questions. We do realise that the topic could be challenging or distressing for some, so please respect everyone's right to express their experiences and opinions and take time out if you need to. And please also contact us post-event if you need any support or want to discuss any content that was provided. And we will be tweeting throughout, so please do tweet about today. ARC Northwest Coast has a Twitter account, so just tag us in if you do. Just a really brief discussion about ARC Northwest Coast. So ARC Northwest Coast is a large health research collaboration, applied health research collaboration between academic institutions, so University of Liverpool, UCLan and Lancaster, together with health and social care providers, NHS commissioners, local authorities, but also communities and members of the public to support the development, delivery and implementation of research into practice, and with an overarching focus on reducing health inequalities. So the Seldom Heard Forum is a regular forum where we can look at the needs and issues experienced by seldom heard groups so that we can raise awareness and collaboration and think about the research needs and health needs of those and give a voice to people from seldom heard communities. We also will send you out some information about our NHS Futures site where you can carry on conversations, and we'll put all the links and resources mentioned today up on our NHS Futures site for you if you'd like to join up to that. So really brief introduction about today's topic. So today's topic obviously is refugees and people seeking asylum. And I just wanted to put up the definition of a refugee, which is someone who, owing to well-founded fear of being persecuted for reasons of race, religion, nationality, membership of a particular social group or political opinion outside of their country of nationality and unable to return to it. And an asylum seeker is someone who seeks asylum or safety in a foreign country. This is a legal process, and they have applied to that government in the hope that they will be given refugee status. So the right to seek asylum is a legal right that we all share, and it isn't illegal to seek asylum because it is a legal process. Regardless of how people arrive in a country, people who come to the UK or any other country seeking safety face a number of issues which threaten their dignity, their safety, and in some cases their lives. Information from this was gained from Refugee Action UK. I've been personally reading a book called Boy Everywhere about asylum seeking to my son, my 11-year-old son. And I just wanted to put up just briefly this poem called Home by Warsan Shire. I don't think we've got time to read now, but it's a fantastic poem if anyone wants to look it up. So we're going to now move on to our first speaker session. So I'll stop sharing and pass over to Victor.
Hello, can you hear me? Okay. Good afternoon, ladies and gentlemen. Thank you very much for joining us, and I appreciate to become one of the first speakers among the great speakers who will be speaking after I've spoken. As I've just introduced myself there in the chat, my name is there in the chat, and then the organization I represent is ANALEG, meaning Asylum, Lived Experience, Refugee Action Group, which is to be registered soon. We just have some process within the Liverpool City Council, but nevertheless, we are still functioning because it's the reason why we formed this grass group. Firstly, I would like to read, the slides are there, but I'll be reading here as well. There are 21 specific individual asylum seekers, including me as well. Their well-being is in great danger because they cannot afford to pay the amount of $350 for their medical reports to support their current asylum claim cases, Rule 35 and the GP supporting letters. They have lived experience of torture and survived from their country of origins, and now, worse off, they are on the list to be deported to Rwanda.
You on there? No, you were here.
Could we just remind everyone to put themselves on mute, please, if you're not speaking? Thank you.
They are in the list to be deported to Rwanda. As I'm speaking, 3 of our members, 21, which I'm part of them, they're already in detention center again in Colenbro, where I was, and then released, that is in March this year. These guys are already in detention center, 3 of them. Most of them have been diagnosed with PTSD and are still waiting to see the therapist since 6 years ago and still counting. The above mentioned experiences that these groups of people are made to endure are some of the many factors, some of the pull and push factors of their root cause of mental health breakdown for them, and sometimes eventually impact their children and families negatively otherwise, health-wise, sorry. 4, our fellow refugee members cannot afford access to some of NHS healthcare treatments because of their status that does not allow them benefit to access public funds. 5, there are individual specific cases where I have proof and tangible evidence, but I cannot mention their names to protect them since got pending asylum cases because of delays, red tapes, and late diagnosis. They ended up developing complicated cases. They now suffer from cancer, stroke, and etc. Right? And the NHS charged them all over 100,000 each person because of their immigration status. That is refugee, have no funds, public funds. Number 6, to conclude, our fellow refugee and asylum seekers sometimes face racial profile hostile environment in terms of well-being, health issues, and social care equity. Arguably, obviously, on the other hand, you can be grateful that you have immigration freedom. That is, you are now a refugee, you got refugee status, but you can't do anything with that freedom. 7, in view of above, ANALEC was formed on the 3rd of March 2022 to look for funding to empower and develop our grassroots communities, lived experience survivors, activists, advocates. Thank you very much, ladies and gentlemen. That's the end of my presentation.
Thank you, Victor. That was really interesting. And would you like to add a little bit more about your personal experience, Victor, about trying to establish your action group in order for you to support, people who are seeking asylum?
Yes, the issue is that, as I said, lived experience. I'm part of those guys. Specifically, I was also detained, and then on the 3rd of March, I was supposed to be deported to Rwanda, and with these other guys, 21 of us. But fortunate enough, we're to win what to call a judicial review, and then we've been released. Since we've been released, that is on the 12th of March. 3 of our members have been already detained again. The reason why is that because when you seek asylum seeker and then you are in a situation whereby you are a victim of torture because of political opinion, say for the country where I come from, and then you find out that the Home Office won't believe you, they need what to call second opinion. Yes, you can go to the GP here. The GP can say, all right, this person has been tortured because of the scars, so everything, then diagnosed. When you're being diagnosed, the issue that the Home Office itself doesn't accept the GP. They say what second opinion. Second opinion is like medical justice and the others, say freedom from torture and others. Now, such organizations, say like, for example, medical justice, when you ask for what to call collaborating evidence, that is, you've been tortured, they call it Rule 35. They ask you to pay about 250. You don't have that money. And the GP also, they need a letter. When you go to the GP, you ask for a letter. The GP, they say, because it is a letter, you have to pay £100. So 250 plus £100. Some people, I'm one of the lucky ones because some of the letters I've gotten from my GP because I'm part of what's called Patients Participation Group. And as you can see, I have nothing to lose, I have nothing to fear. I speak for others. This is the reason why we formed this organization. Some people cannot speak for themselves. So there are not many who are in this position. Their asylum seekers are being told that your case has got no merit because you do not have the evidence. So that is the issue. Now, when you try to ask for help from these other organizations, they refer you to another organization. Then another organization refer you to another organization. That's the merry-go-round. You don't have that time. This is the reason why us service users, the people who were forced to form what to call this group, ANALEC, because we do not have time.
Victor, someone has asked whether you have a link to your organization. Is there a website or any way? I know you put your email in the chat, but is there any more information about your organization or any links?
It's a good question. We don't have yet because we do not have the resources. We are developing. We're trying to have the what to call, because I approached one of these guys. They say, if you want to have a website, you must pay. We don't have money to pay the website. But if there's any other organizations or the invest trying to help us with develop the website, really would be very appreciative. We don't have, we just only have the email.
Great. If anyone has any ideas or support for Victor about his organization, please do. Details.
Thank you.
Thank you, Victor.
Can we get our next speaker, please? It's
Ramadan.
Yeah, from the Salvation Army.
One second, Ramadan, you're on mute. Can you unmute yourself?
Could you just unmute?
Yeah.
Okay. Can you hear me now?
Yeah.
Okay. Hello, everybody. My name is Ramadan. I'm a specialist support worker I work for the Salvation Army. Can I share a screen with you, if you don't mind? I've got a video, which is like a around 10 minutes. It's a bit long. I'll try to make it shorter, maybe, to talk about what we have been doing with asylum seekers and refugees. Let me share screen, please.
If you also can share, like, pick a snippet of it as well, Ramadan, because it gives you a chance to even speak, you know.
Okay.
Yeah.
Can you see the screen?
Yeah.
Okay. Okay. Can you hear as well?
Yeah.
I'm the assistant visa manager at Homeless Services.
Ramadan, is there any way you can, we can't hear the video?
Sorry?
We cannot hear the video. Can you put the volume a bit louder, by?
I have a feeling that when you share the video, you have to share sound on your computer as well.
Sound in the computer. How would I do that?
There's an icon at the top, so if you go on that, it should let you share sound.
You might have to unshare and then reshare, clicking that.
Have you got the presentation as well, Ruth? Could you not do it from your side?
I haven't got the presentation, unfortunately.
I couldn't send it because it contains a video.
It's probably too large.
Yeah.
If you stop sharing your screen and then start sharing it again, it might ask you about giving access to the computer for audio. That's it.
Managed to do that. So Ramadan, when you share your, you normally say share sound as well.
Ramadan as well.
Okay, it seems that there's a difficulty here. Anyway, we have been working with refugees and asylum seekers for many years now. We have worked with the Syrian scheme, recently with Afghani and Ukrainian scheme as well. In addition to the asylum seekers, we do kind of family, we visit our clients regularly, and we do have like drop-ins every week. For example, one in Fleetwood, one in Metropole Hotel in Blackpool. We try to help asylum seekers in different aspects. We do have drop-in in Seasiders College for asylum seekers and refugees, in Kirkham and Watcham, St. Anne's as well. This is, for example, a tournament we achieved recently. It was one group team of our asylum seekers participated in a tournament, and luckily they won the trophy. And some footballers, managers, as you can see here, Manchester United manager came to this tournament. It was a big achievement, actually. Among things we do at the Salvation Army, ESOL classes, of course, we provide ESOL classes to asylum and refugees. We register them with the colleges, and we provide ourselves classes. We also, not only ESOL, we give them courses about life in the UK, which is a requirement they need for their naturalizations after 5 years in staying in this country. Also, another course we provided recently is a driving theory test for refugees and asylum seekers, as this is they have big difficulty passing their theory test. So we try to help them. I think that's the end of the presentation. We've been working really hard with those, especially asylum seekers. I don't know if you are aware, there are like maybe more than 400 or 500 asylum seekers in Metropole Hotel in Blackpool, and they are really in terrible, I would say, situation. They really need help all the time. So we go there regularly and we try to support and help them. Thank you. I think that's the end of, I really wanted to share the video, but it didn't work. Thank you for having me. Yeah.
Thank you, Ramadan. That's really good. I mean, if you can share the link for the video on the chat, people can get to see it
okay.
Separately. But thank you so much for that. And it's great that some of the hard work that you do. Out of your experiences, what would be your recommendation for, let's say, researchers who are looking into health service research or healthcare providers, in order for them to be more inclusive of asylum seekers and refugees? What would be your recommendation through your experience?
Well, as I said, we worked with Syrian scheme, with Afghani scheme. To be honest, those schemes, those refugees, when they come, we provide everything for them in terms of houses, everything. They enter the house, everything is there. They don't need anything, actually, and we help them weekly. We support them, registering university credit, banks, job center, doctors, dentists, and so on. But the issue is with asylum seekers. They really struggle here. And as you know, they don't have access to public funds. They get only £40 a week. Each one gets on, and imagine what would you do for £40. One of the guys, I remember a few months ago, he told me, he was talking to me, he said, he was from Yemen, and he said, I spent £20 and I save £20 for my family back home to send it. Imagine how would someone live with £20? So they are in a really critical situation. And the issue, they are having the problem with the Home Office. No one answers their inquiries. No decisions. Some of them have been stuck in their houses for 2 years. They haven't heard anything from the Home Office. Lack of service, houses, so many things to talk about, actually. And so I think asylum seekers need more attention in terms of everything. ESOL, for example, English language, they are supposed to, colleges, they provide them only 8 hours a week. Only 8 hours. Imagine, how would you learn English 8 hours a week? That's why we try to get involved in this, and we provided them with some extra English ESOL classes as a Salvation Army, of course, I'm talking about the place where I work. So yes, they are struggling and trying to, they are really struggling and finding it really difficult to cope in this country. So yeah, I don't know if I have answered your question or.
Yeah, no, and you've raised like really important, insight into a lot of times we often put refugees and asylum seekers under the same umbrella. But I've been having this conversation as well with Victor, who's really brought a lot of insight to me. Is, we often do this mistake by, the refugees have got their status and they've got certain opportunities that they can get. But however, someone who's seeking asylum, the process can be quite long-winded, and they can struggle because there are certain opportunities that are restricted from them, and that's important for us as researchers to differentiate between the two, and where support is quite needed as well. For your organization as well as Salvation Army, are you like it's like a charitable organization that is funded? Do you feel sometimes that funds can be limiting to what support you can provide to these populations?
Yes, of course. It's a charitable organization. We get funds from Lancashire County Council, from different areas sometimes. But as you said, it is somehow restricted. They ask you to do with this fund, you have to do this and this and that. But to be honest, sometimes what is needed is not this. We need something else. So we try to work around this, to be honest. I mean, asylum seekers, they really want to learn English. One of them, I'll give you an example. Recently, one of the guys, he was one of the African countries, I can't remember exactly. He was a very nice guy. He was in my class, and I support him and help him. When he came, he didn't speak a word of English. After 3 or 4 months, working so hard, English classes and so on, he spoke very good English. And we managed, I applied for work permission for him, because asylum seekers, they are not allowed to work, but I applied for work permission for him, and luckily he got it, and we found him, we got him a full-time job actually.
That's very good, because otherwise without your support they probably would have been still struggling.
Exactly. This is another issue, work permission. I've been doing this. I've been receiving phone calls from all around. Well, we work around Lancashire only, but I've been receiving phone calls from all around this country asking me to apply for work permission for them. And, you cannot say no in these circumstances. People want to work.
Yeah.
They cannot just stay at home all the time. Imagine the terrible journey they went through when they arrived to this country.
Yeah.
Most of them, they're having some mental issues, to be honest, because of terrible, horrific times they went through during their journey.
Yeah.
So we try to help them get out of their houses, to see people, to integrate. Plus, we provide them sometimes some trips.
Yep.
Outside.
Excellent. Thank you so much, Ramadan. That's really good. Really appreciate your insight into this. And I'm sure there's more people discussing in the chat. And I know Victor has a lot of insight into this as well, about this delay system of status reply, and how people struggle during that period, especially if they're looking for work or supporting themselves financially. I think that's important to highlight. And access. So I'll pass on to Selena. I think we have our next speaker up, and Ramadan, watch out for the chat. Maybe some people probably have some questions there for you, and if you want to share your details as well, that'd be really good.
Thanks, Shema. Yeah, I think our next speaker is Emma Leeper. Emma, are you ready to present?
I'm ready, yeah. Can you hear me and see me?
I can hear you. I can't see you at the moment. Just a minute, Ruth will probably pin you.
Trying to find you to pin you.
Can you see me now?
Yes.
Yes. Yeah, I can see you now. Brilliant.
Thank you. Can I just say firstly, a huge thank you. It was really interesting listening to you, Ramadan and Victor. thank you for sharing all of that with us. And I'd love to be in touch, actually. I'll leave my email in the chat. So my name's Emma Leaper, and I work for a charity called Asylum Link Merseyside. And we're working on a project called the Action Asylum Project. I'm a registered social worker, and I've been at Asylum Link for a few years now. So I'm going to start by talking about Asylum Link and just sharing some general information about what we are and sort of what services we provide, just to sort of be useful. And then after that, I'll go on to talk about why we do the Action Asylum Project and what it's all about. Okay. So Asylum Link has been around now in Merseyside for 20 years. We just celebrated our 20-year anniversary this year. So it started very small with sort of a drop in at the back of a church, and it's ended up, growing from strength to strength with lots of different services over the last 20 years. And we're now based in a big centre sort of up in the Kensington sort of Edge Hill area of Liverpool, just above the university. We're open Monday to Friday, 9 to 5, and we've got a small team of staff. And we're also have over 100 regular volunteers that keep the services running. So we're very, very much fueled by volunteers, are very, very much the lifeblood of what we do up there. And last year, the volunteers there actually won the Queen's Award for Voluntary Service, which we're really proud of them all because, without them, we just wouldn't function. So they're very well-deserved award. And we all got to go down to the town hall to receive the award, which was lovely. So just a little bit more about Asylum Link. So we're a small charity, we're independent. We don't have any central government funding or Home Office contracts or anything. We rely on applying to small trusts. We're very grassroots. We get a small amount of money from the local authority to deliver some of our services. We have a footfall of about 30,000 people a year, so it's a very busy centre. If anyone's ever been there, you'll know what I mean. And you're all very welcome to come and visit as well. So we're very, very welcoming. Every day we do a hot meal at 12 o'clock, which is available for anybody. So anyone can come and get fed a nice hot meal Monday to Friday, 12 till 1. So I'll just quickly go through the services just as a bit of an information thing, so you know what we're about and how people can get help, and then I'll talk about Action Asylum. So we've got a casework team that provides advocacy support, and that's mainly accessed through a helpline, which I'm going to leave in the chat at the end of this presentation. We have destitution support. So on a Friday, we have a weekly food bank, where we help people that haven't got any other access to Home Office support. As Ramadan and Victor touched on, the Home Office support is measly anyway. It's £40.85 a week, which is very, very difficult to live on anyway. So yeah, we have lots of extra bits of support for people in light of the fact that they're living in poverty on that £40 a week. The kitchen, like I said, does a hot meal daily, and the cooks in the kitchen are from all over the world. So it's a really lovely place to come and get your lunch. So please do spread the word around Liverpool if anybody needs a hot meal. We're open every day. There's a clothes project where we give new arrivals to the city clothes. So we get a lot of donations from lots of people around the city of clothes and shoes. Sadly, we can't take donations at the moment of anything else because we just simply don't have the storage space. But we do have a lot of men's and women's clothes, shoes, and you can get an appointment for the clothes project through the casework team. We have ESOL classes, which run every day of the week, and that we have a team of about 20 volunteer teachers who have been teaching from beginners right up to advanced classes. At the moment, our English programme is currently full. We're full of students now. We have no more space, but we do have a waiting list for next term. And we do also have lots of signposting to lots of other places that do English classes in Liverpool. So all you need to do is call the casework team for that information. We have a women's group on a Thursday at 11, and we have a choir that sings every Thursday afternoon 1 till 3, and they're always looking for new singers. So, that's welcome. Everyone's welcome to that as well. We share our building with the Merseyside Refugee Support Network. So as Shema touched on before, we're working with people who are seeking asylum, who are currently in the asylum process, who are going through that process. But once you receive your leave to remain or you get your refugee status, you can access help through the Merseyside Refugee Support Network, who are also in our building. And they're open Monday to Friday. And again, I will share the details in the chat for anyone who needs to be referred in. And they do lots of advocacy work and casework and applications for universal credit and housing as well. At Asylum Link, we do a lot of health promotion. So I suppose this is really relevant for this forum. So we've sort of realised that actually the best way to sort of promote health, because our service users have a lot of barriers to accessing healthcare. So what we've done is we've actually started to invite healthcare providers into Asylum Link to provide things. So we've had a lot of vaccine clinics in our centre, and we've had things like TB awareness sessions, HIV awareness sessions, and most recently we had an eye clinic where I think it was about 30 opticians came into Asylum Link and spent the week doing eye tests for free and giving out glasses to people seeking asylum. So that was really good. And we're hoping to do some more of that work next year. So I guess the point to make there is we realise that actually, because people are in the centre all day anyway, coming in to access English or food or casework, it's actually really great if you bring the healthcare stuff to them and they can actually just access it on site. And that's a really, really good way of doing things. We found we had a really good turnout for the eye clinic. I think we gave out glasses to over 500 people that week. So that was really, really great. Okay, so we have some of the wellbeing stuff that people can join in with. We have a bike project. So on a Tuesday, we have volunteer mechanics who come in and they actually fix up bikes for people, because as was touched on before by Ramadan, you know, there's it's really difficult for people to access the city because of the low amount of money that they're on. You know, the real barrier here is poverty, because the Home Office really don't give a lot of support to people, so in terms of finance. So having a bicycle can make a huge difference because you can get about. So obviously a bus ticket in Liverpool is £4.60, I think, at the moment. And if you're only on £5.80 something a day, you know, you're not going to be able to get a bus ticket and feed yourself, are you? So having a bicycle is a huge plus. So we've put a lot of effort into the bike project. And there's also bicycle rides. So we've been working with our partners at Cycling UK, and they've been training up some volunteer cycle leaders. So when people first arrive in the city, we've been able to orientate people to the city by taking them on led bike rides, which has been really nice. In fact, I think the bike club last week went up to Anfield Stadium and all got their photos taken in front of the stadium, which was quite nice. So yeah, so that's the bike club. We've got an allotment project, which is actually winding down for winter at the moment. So it's not a good time to join now, I suppose, because we're just about to close it. But next spring, you'd all be very welcome to come along and join the allotment project. And we actually grow the food and vegetables for the allotments, from the allotments, for the kitchen and the food bank. So it's a really nice project that sort of feeds the main centre. And we found that being out in nature, gardening, and just, it's really low stress, and people can make friends, practice their English, and learn how to grow some vegetables. We found it's been a really, really successful kind of well-being and mental health alleviating activity. So we've got some other projects that are up and running, all under the banner of Action Asylum. So I'll just move on now to talk to you a little bit about what Action Asylum is. I'm conscious of the time. So Action Asylum project, it's a national scheme. So the idea is we're bringing together asylum seekers and refugees and local people together to volunteer together. So all of the other services I just spoke about are things where we're providing things for asylum seekers or refugees, you know, a service to them. But the Action Asylum project's a little bit different. It's actually asylum seekers and local people together providing a service for the neighbourhood and the community. So going out into the community and doing voluntary work. And the main driver for this is because asylum seekers, while they're waiting for their claim to be decided, they have no permission to work in the UK. That, you know, if you've been waiting for a year, you can apply for permission on something called the SOL shortage occupation list, which is a very, very small list of very specific jobs. But actually, the majority of people seeking asylum cannot work. So we found this is obviously a very difficult situation for people. You're talking about people who've come from, you know, a profession, perhaps they're used to a busy day, they're used to getting up in the morning and going to work, and all of a sudden this is taken away from them and they're unable to work. And we find it immediately de-skills people and just makes people feel awful. So the Action Asylum project, we aim to get people into voluntary work as give them something to do, sense of belonging, sense of purpose, and also keeping those skills and meeting new people as well. So that's what it's all about. And we've got projects all around the UK. So we've got 5 cities where there's Action Asylum projects, and we've got some funding to expand to a further 3, but I'll come on to that in a little bit. So in terms of volunteering, so why is it important? I've already mentioned quite a few reasons, but the other thing is, you know, people feel really isolated when they're here, and, you know, it's a really good way to integrate and meet people, because if you're working alongside someone doing a joint task together, by the end of the day, you know, you've made a really good connection. And it also has the knock-on effect of actually teaching the general population about people seeking asylum and breaking down those barriers and changing perceptions, because as we all know, people seeking asylum are the same as people who aren't seeking asylum. They're just people who are in this situation, unfortunately, in the asylum process, but they are skilled, professional, driven, resilient people who have something that they want to say and contribute. So we are trying to promote that through our project. So how do we do this? We do it through lots of kind of big volunteer days out. So we do things like going out to clean beaches. We have planted a lot of trees. We have lots of skilled placements where people are matched up with their skills to positions in the community. And we do a lot of conservation work, because we found that actually by doing something like conservation, we can tell a really positive story, you know, about what we're doing, because everybody cares about the environment. And of course, we have a looming climate crisis that we need to be thinking about as well. So it kind of marries all those things up together. So we've been doing some great partnership work with the British Red Cross, the Canal and Rivers Trust, the Wildlife Trust, as well as the Marine Conservation Society. Right, so impact. Since June, when the pilot project ended and we went on to the new stream of funding, we've engaged with 246 people over the last 6 months on this project, and that's just in the Liverpool project. And in terms of impact, I'm just going to read a quote now from one of our volunteers. Okay, so Ashkan, he's a lawyer from Iran, and he was forced to flee and seek asylum elsewhere. And he said, "In this country, refugees have to start again from zero, and it's so hard to rebuild our lives. And that's why activities like this are so helpful. In Iran, I was busy every second of the day with my work and taking care of my family. I don't want to be an idle person and waste my time. Cleaning the beach and going out and planting trees allows me to speak with people and improve my English, rather than being alone and bored in my shared house. I'm a sociable person, and I don't want to be depressed." Ashkan, who's been waiting for 16 months to hear about his asylum claim, also added, "For me, this project helps refugees and asylum seekers to connect with others in this country. It helps the local English people understand that we can be helpful for this country and build good relationships with others." So that was a quote from Ashkan, who's one of our fantastic volunteers from Iran, and he gave me permission to share that with you today. So I'll just wrap up now, because I'm very conscious of the time. So we've now got in Liverpool a new project lead for Action Asylum. His name's Rory. He's just started a month ago. So he's going to be coordinating all of the local activities, volunteer days out and placements. So I'll pop his email address in the chat for you at the end of this in case anybody has a referral to the project. That would be great. And then finally, just the national picture that I touched on before. So we currently have Action Asylum projects in Portsmouth, Stockton-on-Tees, Leeds and Cardiff, as well as Liverpool. And we've got plans to expand to Coventry, Bolton and Newcastle as well. So the idea is, by creating a big network, it doesn't matter where in the country you are, we're hoping to expand further than that. So anywhere that there's somebody seeking asylum, there will be an Action Asylum project that they can get involved in and start getting some volunteering experience. And the final thing I'd just like to end on is that we had a wonderful event recently at the House of Commons in London, where we were invited by a group of MPs to go down and speak about the project. And the best thing about that was that the MPs and the leads from all of the NGOs actually had chance to hear the voices of the volunteers, the asylum seekers themselves, going through the process and talking about how frustrating it is that they do not have permission to work. So that was a really successful event we had a few weeks ago. So I've come to the end of my notes, and I'm happy to stick around for some questions. I hope I haven't gone over too much in time.
No, Emma, that was absolutely brilliant. I could listen to you all day, honestly. Whatever she said, she's still underselling Asylum Link. It's an absolutely amazing organisation, and I've been involved with your cycling and cooking sessions, and honestly, it's very welcoming. And anyone who hasn't been, I would, suggest you take a visit. There are a few questions in the chat if you'd just like to have a look at them, Emma. Over to you, Shema.
Yeah, no, thank you, Emma. I can't, this is really excellent to hear this inspiring work that has been doing, you've been doing. I think it's just a firing question, because I know I've seen it in the chat mentioning about how third sector and charitable organisation, often the burden falls onto them to carry the weight of having to, the gaps that we have within our systems. I mean, how has been for you, and what do you feel should be in terms of collaboration and partnership, that should be something that could be a support of these individuals and for you, for the work that you do as well?
Yeah, I mean, I think just partnership working all the way. Like, we're already doing some great work with the CCG through the Green Spaces funding and more things like that. But also that, like I touched on before, I think bringing health to Asylum Link is the best way to kind of get people to access it. A lot of what we found, it's about building relationships of trust with people, and it's also about barriers to getting to services. So we already have, people are already here, they're in our organisation, we have their trust, we're working with them already, so coming to us to deliver things really works. But also, like I say, just recognising that barrier and knowing that some people are housed a really, really long, far away from services, and there's just not money for transport to get to places. So maybe finding ways to sort of, fill those gaps in terms of transport. And I don't know if it's something the CCG would be able to look at more, but I mean, we already work really well together in partnership. And I guess the key to all of this, being a third sector charity with not much funding, it's partnership working all the way. We wouldn't be able to do anything if we didn't work in partnership with lots of different organisations. So I guess just more of that, really. I don't know if that answered your question or not.
Yeah, no, that's great. I think that's really good, Emma. Thank you so much. And also, I think there's a question in the chat, and I think I can reflect on that as a researcher. We often do want to involve public members to be involved in some of the work that we do. And we aim to try to be as representative as possible, which is including refugees and asylum seekers. And, we find the struggle of, we often compensate, there's people that compensate for public involvement, for a small amount of payment that for their contribution, basically. But I know with asylum seekers, because they don't have the status to work in the UK or receive funds, it's sometimes it's difficult. So from your kind of experience, what could be an alternative for us as researchers to still continue involving these groups of population, but also supporting in that process, and not fully exclude them of that support?
Yeah, so in terms of support, in terms of I would say things like obviously providing travel expenses and lunches where possible is great, but actually things like training. So providing something where at the end of it, the person has a certificate or a further link to, because at the end of the day, we're hoping that everybody's going to get their refugee status and have permission to work. So anything that can count towards their sort of stepping onto that ladder of employment afterwards is really, really useful. So where possible in the Action Asylum project, we've been trying to provide training opportunities for people that actually have certified, or something at the end of it that they can sort of show and put on their CV. Things like that are really, really desirable as well. But yeah, travel expenses all the way, and lunch expenses, you are able to provide those legally. So yeah, I can send you some more details of that from our volunteer manager, Gareth. He's got all the kind of black and white on all of that stuff, the print and stuff. So I'll send that to you.
That'd be brilliant. That'd be really useful, and we can share it with people who are interested. And I've seen people in the chat actually mention something. That's good. Thank you so much, Emma, for coming in and joining us in this, and great work, and it's very inspiring to hear that. I know Victor's got his hand up. A quick question before I think we've got like a nearly 2 minutes break. Or Victor,
a quick one. Thank you, Emma. I've got a question. Some of our members face the problem of, I think you have heard it before. They say if your accommodation has been exhausted through group 4, and then you have nowhere to live. Now they are paying rent from private renters. Do you help them with accommodation, or do you know where they can get money to pay their rent? Because if they don't do that, the Home Office doesn't accept them, and they are living with friends, they have to pay rent. And secondly, how do you help in the sense of most of our members, if they're being detained, the solicitors need about 7,000 money for them. So do you help them with solicitors or help them with the funding? How can we get in touch? Thank you. Sorry. There's a lot of questions, but thank you.
No problem. There are definitely questions that need to be put to the complex needs team at Asylum Link, and I will definitely put the details out in the chat. We would need to know the individual circumstances. We don't actually have funding to help with solicitors' fees. We're quite a small charity, and like I said at the beginning, we're very much reliant on different pots of funding for different projects, and we most certainly sadly don't have funding for solicitors. But what we might be able to do is advocate. We have some fantastic social workers working on the complex needs team here who might be able to advocate on your client's behalf, on your friend's behalf. So what I will do is, Victor, is I will pop in the details of the complex needs team into the chat, and please do send a referral through and we'll have a look at it and see what we can do.
Great.
Brilliant. Thank you
Emma.
so much, Emma.
Okay, thanks for having me, guys. Nice to meet you all.
Thanks, Emma. We're just going to have a quick comfort break for anybody who wants to just nip into the toilet. Shall we just say 5 minutes if everyone's
5
back by?
minutes. Thanks, Naheem. And we're going to move on to our next speaker, who is Layla Saeed, the Community Inclusion Lead from Central Liverpool. Are you there, Layla?
Hiya. Hello.
Hi.
Yeah. So I'm just going to share my screen. I've not used Zoom for a very long time. There you go. Can everybody see that?
Yeah.
And I'm actually using Canva as well for the very first time as well. Okay. So hi everybody, my name is Layla Saeed and I work for the community inclusion team at the Life Rooms at Merseycare. One of the services I oversee is obviously the community inclusion team, but I also oversee the day-to-day management of Central Liverpool Pathways Advisor team and also a social prescribing service within White Pass. So yeah, so the community inclusion team is actually a new service. Well, not actually new, but it was two services that came together in March 2022. Yeah, and that was it brought together two services. That one was working within primary care that was focusing on health access, and the other team was a team that was under Merseycare for over I think a decade or more, and that was focusing on improving access to mental health. But as both services came together, one was under the primary care trust, Liverpool City, Liverpool Community Health, and then they transferred over to Merseycare in 2018. It was just recognising that those two services actually serve the needs of the same population, and it just made sense to bring those two teams together. So that with the aim of improving access for the population in Liverpool. Okay. So the overall aim of the community inclusion team is to improve access to primary and maternity and mental health services. It also incorporates, which is new, a social prescribing element to the model in terms of developing also links with communities, recognising actually that asylum seekers are new into the city and they will come with immediate needs that need to be addressed, but also looking at what their medium and long-term needs are in terms of social needs, and also recognising that asylum seekers as well, and some refugees as well, they need support, not just with their health, but also with other things like housing and education, so linking them into those kind of services. So where our service sits within our Life Rooms model is actually in community is at the heart of everything that we do. Inclusion is kind of looking at everything that entails inclusion in terms of health and population health, and the Life Rooms works under three pillars, sorry. So we have the learning element of our model, and that is like kind of wellbeing courses, pretty much shaped by what our community tells us that they want per geographical area. So we have a life room site in Walton, in Bootle, in Southport. We don't have a physical site in Central yet, but that means that we need to look at alternative ways in which we can deliver our learning sessions. And a big focus of mine is going into communities and asking what their needs are in terms of, like, you know, low level wellbeing sessions and how we can support that in community safe spaces. Social prescribing obviously is linking people into community assets, and how that looks like for asylum seekers, which may be different to the general population. It's quite something that is new to our service, so we're learning as we're doing and as we're developing. And the community inclusion team sits under the inclusion pillar, and that has been massive, because I think there's a lot of work that we need to do in terms of inclusion, in the hope that then we can influence system change, working with providers and the health system and other statutory providers to improve access and inclusion for marginalised communities, asylum seekers and refugees, but also supporting that person on a one-to-one to kind of recognise that, like, you know, the people need support to empower them and become activated in their own health. And I think this is kind of a huge thing that we're anticipating, that will, you know, maybe not be able to kind of demonstrate quantitatively, but the whole aim is to improve population health for these communities. Just some stats there. I can't actually see this because of the camera, but I think just to give an idea of how many people we support, in October we supported 213 people to access health. Now, if you put that into the context of these are new people that are coming into Liverpool that have never accessed NHS services, which is quite different to their own kind of health systems in their countries. Just out of those 213, only 15 of those could speak English as the first language. So that's kind of a massive kind of task in being able to support these people to access health. So what we do, just to give a flavour of the practical support that we do and how we are aiming to add value to the health system. Again, it's a massive task again. So we have regular meetings with key system stakeholders, and we've got a few on the call today. We also hoping to kind of develop cultural awareness with professionals as well, and also bringing in the lived experiences of people to be able to kind of add richness to those workshops. Providing health access to packs to new arrivals. At the moment, we're doing that on a one-to-one. And also, but what we would like to do is to kind of develop a health access campaign. So people as soon as they arrive, they understand, they have the information to be able to access, you know, health. I think we need to recognise as well that we've literally just been we've been operational since beginning of March on this, and we've only started due to the recruitment of our staff shortages, because we were developing the service. We've only just started this in September, but we're hoping to be really focusing on these pieces of work going forward. And also looking into kind of attend sessions in the community to deliver key public health messages. So one of the things that we've been supporting is with the Kind to Your Mind campaign with Liverpool Public Health. But again, this is where our cultural knowledge comes in. And if we were to go into a asylum seeker hotel and deliver that message, be kind to your mind, would they understand that? So it's kind of adjusting that message to in a way that is more kind of appropriate to their circumstances, without coming along approaching people with that kind of lack of knowledge of the social aspects of what they're going through, or the environment. In terms of mental health and wellbeing, that's been a massive one for asylum seekers for us as well, and that's also how we can support people or services to be more culturally appropriate. And I find that having conversations with services initially to understand what their needs are has been really helpful. And building on the team's knowledge. We have 12 bilingual health link workers or community inclusion workers, and they all come with diverse cultural experiences that are shaping our services internally within Merseycare. Okay. So I just, here we go, that's better. So what a typical client journey looks like when they come to us. So we would receive referrals from PC24, which is the urgent care service, and we receive referrals from Serco. We also receive referrals from a number of VCSE organisations and teams within Merseycare, particularly children's centres as well. We've noticed that we've been receiving referrals for families that have not been registered with a GP, which is quite surprising and alarming. So the community inclusion worker would do an initial assessment to identify what are the immediate needs for this family or this person. And mainly those needs are centred around statutory services, so NHS services, education, housing, all those immediate needs that need to be addressed. Before then, we can kind of support them with then the medium and longer term. So a pathways advisor would have an appointment with that service user or client, and then they can support with what their needs are. And that can be different for different people, and it's really centred about what they want to achieve themselves, or what they identify what their needs are, rather than us doing to our clients. So to personalise and co-create a social prescription. It's been a massive learning curve for us as a service. I feel like every time we go into like a particular kind of area where it's opening up a can of worms. And yeah, so it's been really, really interesting, I would say. So in terms of health service gaps for asylum seekers, particularly those that are living in hotels, has been really massive for us. And what we've found is, rather than where we would previously challenge the system, I had a light bulb moment with when we spoke with Pfizer, who's on the call today. And for me, at that moment, when we had that conversation with Pfizer, it was about, well, you know, we understand what the issues are, and, you know, asylum seekers accessing help. But what is it? How is it for the GPs as well? What are the pressures there? How can we support that? You know, so looking at the perspective of the patient, but also looking at from the health service perspective as well, and the pressures and challenges there. So also in terms of training and awareness to empower professionals to be able to meet the needs of our asylum seekers, and that really started in-house for us as in the life rooms. I regularly attend meetings with various services within our life rooms, and also as we've started to increase our engagement within diverse communities, staff will tell us what are the challenges they're coming across, and then how we then can support them to be able to overcome those challenges. And there is, and we need to be honest with ourselves, there is a lot. Like when a person attends and they don't speak English, then we find that, you know, some of our staff become a bit flustered. They don't know what to do. They don't know how to kind of support them. So providing that kind of support to our staff is so important in the training and the awareness around what services there are. Just today, by listening to Emma, there's a lot of resource and a lot of our support in terms of social activities there, that we really need to be kind of supporting our people to get our service users to access as well. In terms of Liverpool, we've looked into the data, and we found that Liverpool receives the highest proportion of asylum seekers in the northwest region. If you compare that to Manchester, Liverpool significantly receives the highest proportion, and we don't know why that is. That's Home Office data, but maybe it's because our services are quite rich for asylum seekers in Liverpool compared to other areas. In terms of in terms of coordination between service providers, this has been a massive learning curve, or lessons learned for us, because we've been working quite closely with Brownlow Health and Central Liverpool PCN in identifying how we can best meet the needs of asylum seekers. And I feel like, you know, having those conversations has been key, particularly with Brownlow Health, meeting the needs of asylum seekers in hotels. Farida's on the call today, and we regularly meet up with Farida, and we've developed a process and where we are able to kind of you know, have that open communication and liaison with the Farida, our care coordinator at Brownlow, to be able to support asylum seekers in terms of their primary care health. And also, I guess, care and compassion is essential. If there's no care and compassion, it does lead to a really kind of negative patient experience for us, and we get that feedback from our clients that we see. We always try to kind of support health service providers to be able to improve that patient care, and we're always happy to support or help with that. So taking all that learning, what we found is like how we kind of, in terms of our service, it's all about how we support with access, whether that's access to health or access to other statutory services. So I guess this came from the light bulb moment that I had with Pfizer around like how can we look at things from two perspectives, really, from the people and the community's perspective, but also from our systems perspective. So what I'm quite my background is in public health, and I like frameworks, so this has been adapted from a conceptual framework. I'm not even going to attempt to even kind of say his name, but it helps me just think how we can kind of put this down on paper to be able to evidence like kind of our approach. So obviously healthcare access, for example, is quite complex. A concept closely related to health systems performance, and this framework kind of takes into account population health, and what barriers are there to access from a patient's perspective or a community's perspective, and also taken into account from a health systems perspective. So in terms of like, if we go to perceptions, it's looking at like, well, what is the perception of a patient, for example? What in terms of their health literacy, in terms of their health beliefs, in terms of their expectations as well, which can be quite different and challenging at times, because they come from new arrivals have different expectations of the health system. If we're able to look at then the ability to seek out healthcare, how does that look as well? What are their personal social values, the cultures, and what is, you know, do they have gender autonomy? In terms of the ability to reach into, you know, a service, what is their living environment has been mentioned quite a lot, about like asylum seekers being kind of placed in kind of the outskirts of the city. How does that work for them in terms of their transport and their mobility, and the social support if we're looking at social needs and community assets? So a lot of community assets are in central Liverpool, that people in the L9 or L25 maybe, you know, struggle if they're only on a very limited income. In terms of ability to pay, this is massive as well. If they don't have the HCQ certificates, they will be charged. I used to work a couple of years ago in the women's hospital, and the overseas officer would attend the clinics, you know, to kind of take documentation. And I thought we used to always feel that's an absolutely inappropriate challenge, in that we used to challenge that all the time. I used to refuse point blank to interpret for the overseas officer, but it's ensuring that people kind of understand why they need the HC2 certificates as well. And then also looking at the ability to engage, and this is also a massive one. We want to empower people to be able to access services, and also provide the information, and people kind of can do that on themselves without our support. Looking then over to the other side of the coin, which is health services, approachability, you know, is it transparent? Is it kind of in terms of outreach information and screening and things like that? Is the service acceptable? I mean, this is a massive thing. When I was working for Step Forward Psychology Services, is their service acceptable to asylum seekers? In terms of availability as well, again, the geographical location, the accommodation, the hours of opening, appointment mechanisms, massive in the GP practices as well. And also affordability. This is part of the framework that I don't fully understand yet. Do I need to understand it? I'm not really sure yet, but we're still looking into that. And then also kind of how appropriate that service is in terms of, you know, interpersonal quality, coordination, continuity, and stuff like that. Okay. And that's the end. Thank you so much.
We'll leave questions till the end because we just want to get our last speaker in as well. So if you can just have a look at the chat and see if there's anything there. Our next speaker is Helen Stanford from the Liverpool University. She's going to present on unaccompanied asylum seeking children. Helen, are you there?
I'm here. Thank you so much.
Hi,
I've got my slides here, but I did send them through, but really late in the day. So do you want me to share my slides?
Please, yeah, if you don't mind. Is she
Yes,
able
please.
to?
Thanks so much. And thanks so much for all of the other presentations, which have been so thought-provoking and inspiring. And hopefully some of the issues that we raise here will kind of touch on many of the issues that have been discussed on that more sort of practical service provider and service users experience that we've already heard. I guess we want to shift the focus here to the research agenda and how we manage and construct research in a way that is sensitive to all of these issues, but also the needs of asylum seekers in particular. And this is a project that I've been running in collaboration with colleagues at University College London and Southampton University. And my colleague Will Shankly is also on the call here. He's at Nottingham University and was the principal researcher on this project too. And we have been running a nearly 20-month project now on the impacts of COVID on young asylum seekers' experiences of asylum in England. And we're particularly interested in how COVID is both compounded and also been used to legitimize some of the, and even weaponized to the detriment of asylum seekers. We focused in particular on young unaccompanied asylum seekers from across the world, aged 16 to 25. And one of the distinctive features of our research has been that we've engaged a number of young peer researchers, and by peer researchers we mean those with lived experiences of the asylum system. We worked with a civil society organisation called Spressa, which supports young Albanians. And we worked with Spressa because we had a previous link with that group, and their young asylum seeker service users had identified a need to kind of help us construct this research project, A, to give voice to their experiences, and B, to kind of focus on the impacts of not being allowed to work, which has already been discussed, the excessive delays and the impacts of that on their mental health. And so we constructed our research project around what they saw as the kind of real urgent issues that we wanted to address. So we recruited 12 young Albanian peer researchers to help us with the research, and to help, A, help us design the research, but B, help us to carry out and analyse the research findings as well. And then in the second phase, we recruited 2 more non-Albanian peer researchers. And we then went on to interview 69 young asylum seekers unaccompanied. 40 of those were from Albania and the other 29 were non-Albanian. We interviewed 53 practitioners as well, so legal practitioners, social welfare practitioners, Home Office representatives, civil society organisations, and policy kind of people. So we did detailed sort of semi-structured online interviews with all of those, and we're just at the end of the analysis now. I guess what really struck us as the project unfolded was the impact of our research in and of itself on these young asylum seekers. And although we'd received full ethical approval, we were very robust in our ethics. We've been working with children and young people and young asylum seekers for many, many years. It became really apparent in the course of this project how we really needed to go beyond ethics to construct research that was really responsible and appropriate, and that really was sensitive to the trauma that these young people had experienced, and that the sort of standard ethical framework for research is simply not fit for purpose. And we find it became very apparent in the course of our research, both with working with the peer researchers and with engaging with all of the other respondents, that the very process of talking to them about their experiences, not just of the issues that caused them to seek asylum in the first place, but their experiences of the system in the UK, was deeply traumatizing, and that we were part of that. We were maybe combining it. And so we had to really reflect seriously on the ethics of our own approach. In the course of our research, we had one of our young peer researchers who attempted suicide as well, and that really sort of was shocking for us in terms of how we should take responsibility for the way that we were running our research. And I think the other reason for trying to scrutinise how we could adopt a more trauma-informed approach was that we can't possibly begin to make recommendations around trauma-informed practice or trauma-informed policy if our own research doesn't kind of embrace those methods, or at least attempt to embrace those methods. So there was a kind of dual function for this. I guess our starting point was this peer research approach, and this participatory methodology is really it creates lots of opportunities to think about how we can do a trauma-informed approach to research. And we were kind of staggered that there was very little work done on trauma-informed approaches to research. And I guess it's a call for anybody in this network on how we can work together to make sure that trauma-informed approaches are fed through not just practice and policy, but are really fed through right to the research process, and how we can share our experience and methods in this way. I guess one of our starting points was to really understand what trauma actually is and what trauma-informed approach, how we define a trauma-informed approach. So this paper was, we've written a paper on this that's led by Will Shankly, who's on this call. But we know that in the literature around trauma that it's dominated by a heavily medicalized model. But we've also seen this kind of different, an extension of trauma-informed definitions to things like structures and processes, so that we're moving beyond the, what's wrong with you sort of questions to what has happened to you, and what processes and systems, as well as what experiences are kind of being layered onto your the way that trauma is manifesting itself in your life. So we wanted to really understand what trauma meant for our young people in our study as our starting point, because trauma is so heavily contextual, and that you can't just adopt this one size fits all approach. So we started with really understanding, going beyond this biomedical approach to looking at the multiple dimensions of trauma for our group of young asylum seekers. And we know that there are multiple kinds of causes and effects of trauma. The first is this kind of structural trauma that others have talked about on this call, that our very asylum regime is traumatic and it's violent, and this whole notion of systemic slow violence that's being kind of perpetuated by our system. The other important factor that I think has been less kind of recognised is that, age massively impacts on the way that trauma is both expressed and experienced. And so we needed to really factor that into our methods. And the third other big factor that has been talked about by others is the importance of culture to how trauma is experienced and expressed. And so just in terms of our own systemic kind of issues, we know that, and it's obviously it's in the news at the minute, but this kind of the systemic prejudices against certain groups. And say, if we take Albanians, for instance, the cynicism regarding our Albanian community, how Albanians are considered to be primarily economic migrants and not deserving asylum seekers, that their credibility is routinely questioned. And we see this with other migrant communities as well, asylum communities, that there's highly biased country information reports around certain communities. Albania in particular is seen as an EU candidate country and relatively kind of well positioned, and certainly not a country that persecutes individuals in accordance with Refugee Convention. But all of those kinds of prejudices belie the significant complexity of Albanian cases that we see in our sample. Lots of experiences of trafficking, family blood feud, modern slavery, and that lots of these issues are kind of layered on top of each other for any individual. So what we did is we started by really asking our young researchers what their definition of trauma was, how they understood it. And this is a kind of a photograph of their sort of post-it notes. We had a residential research retreat in West Wales where we sort of spent a couple of days talking about our kind of contextual framework for trauma. And we also made sure that we had these weekly team meetings so that we could kind of construct our methods together in a way that was more sensitive to people's individual and collective kind of sensitivities around trauma. And we've consulted with them on a weekly basis, really, around how we can adapt different stages of our research process in a way that has been, it continues to be sensitive to the sort of trauma twists and turns of their journey. And this is the kind of stuff that came out of both the interviews and their reflections. So some of them talk very much about the traumatic effects of the asylum process here. In fact, they talked more about the traumatic effects of the asylum process here than even their own experiences that led them to seek asylum. And it's really important that kind of this is recognised in the research that we do and the recommendations that we make. And secondly is that this kind of cultural element that mental health and the way that mental health is viewed in different cultures, the way that mental health issues are both confronted and expressed, are massively culturally informed. And so this Vinny there talks about how most Albanian families, that if you've got a mental health issue, you're talked about as a crazy person and they don't like discussing things outside the family, and that really impacts them on the way that trauma is expressed. And we had to really think about how to accommodate this within our research design. So we started by really kind of coming up with our working definition of trauma. So this is Will speaking to some of the young asylum seekers, the peer researchers at our residential. And our working definition is this: that trauma is a person's experience of an event, series of events, or a set of circumstances that are physically or emotionally harmful or life-threatening. Trauma can have adverse effects on the individual's functioning and mental, physical, emotional, and spiritual well-being. The nature and extent of those effects are informed by cultural and structural factors. So we felt that that kind of really broad definition of trauma was an important starting point for us beyond that kind of biomedical model. So this is the kind of way that we brought all of that to bear on our research. We felt that our weekly discussions with these young people, to invest them and to empower them in the research process, was absolutely crucial. We had to really think about how we managed each stage of the research process to minimise the traumatising effects So we didn't talk about interviews as interviews, if you like, research interviews as interviews in the way that you normally would with research, because of the heavy association with kind of home office interviews. So we talk much more about discussions rather than interviews. We had protocols around the interviews that allowed lots of breaks, but also pre and post interview briefings with the peer researchers and a check-in for the respondents, so that we could check that, you know, that they had the support around them at the time of the interview, because of the, you know, the potentially triggering effects of what we were talking about. We were, in terms of analysing all of the additional data, we've conducted loads and loads of interviews with different home office staff and lawyers and social workers, some of which are raise some really difficult issues for young asylum seekers to maybe digest, some quite hostile comments. And so we had to really think about the extent to which we would allow or enable those young researchers to access that data, whether it would be invoke too much anxiety. But we had to really balance that against that kind of overly paternalistic, disempowering approach, which might exclude them from what is the reality of our asylum process. And so we find that just that open communication with them, warning them at the beginning of each kind of session of analysis that this might have some really triggering data, that this is a particularly kind of hostile respondent or a particularly cynical perspective, and to give them the choice then as to whether they wanted to engage with it. And so this is a kind of final set of reflections about, you know, how do we work together as a community, not just of researchers, but healthcare workers, civil society organisations, other practitioners, to create a trauma-informed, very comprehensive trauma-informed approach to asylum work that threads trauma-informed approaches right through every stage, right from research right through to policy implementation or policy recommendations and practice. And there's an enormous amount that we need to learn from people like you here about how to do that better. We're struggling to see how you can do it without a peer research model, but we're really open to thoughts about how we could do it without recruiting peer researchers. One of the other things that we felt was really necessary was to have our own, to cost in for our own mental health support, so that we're doing more than just referring people to mental health services and saying, if this is really, if this research process really affects you, then here are a bunch of services that you can contact, to having our own dedicated mental health supports work alongside us throughout the course of the project. And obviously, you know, how can we construct a really good training program around this, and appoint a group of young people or peer researchers that can feed across different stages of policy implementation, policy recommendations and practice. So that's it really. If you'd like any more detail, here's our email address, and we'd really like to kind of take this conversation forward.
Amazing. Thanks, Helen. Everyone's stunned into silence. There was so much. I just wish we had another half an hour to properly be able to get into. I mean, I know myself and yourself have had some conversations about, you know, the importance of this kind of work, and it's been so interesting to hear about, you know, how you planned your study, and you know, and I think that was really interesting what you said about, you know, the peer researchers and you know, really thinking about not re-traumatizing but also not excluding people from taking part in co-production of research. Is there any questions from anyone that anyone would like to put your hand up if you want to? I know there's some in the chat. Was that a question? Victor?
Yes, thank you. Emma, hello. I'll just ask one question. On behalf of our members, you said, if I heard you correctly, you specialize with, is it from 18 to 25?
16 to 25.
Or 16 to 25.
Yeah. So
all right. So my question is that then those members of ours who are 26 and above, it means they cannot get help from you. And if not, how could they get help? And secondly, why did you specialize only on that age group? Is there any other what you call specific reasons which you think that these things, they're not intertwined? Why I'm asking so is because these people, our members, have got families. Because if it affects a father, it affects them as well. So now, if they're not intertwined in your research, how is that you could find what we call outside of the box unbiased research? It's only a suggestion.
Yeah, Victor, I think they're such important questions. Okay, so the reason why we looked at 16 to 25 is because we were particularly interested in unaccompanied asylum-seeking children, but we recognise that most of those arrive at 15, 16, 17 years old, but most of them are in the system for until they become young adults. And many of the young people, all of our young people arrived as children and still in the system. So we just wanted to capture that specific kind of legal cohort because they have specific safeguards that should have been protected even during a pandemic, and obviously they haven't been. But that is not to say that the findings are only relevant to children and young people. I think that if you get a system right for children, you generally get it right for everybody. And that the lessons that we're learning about a trauma-informed approach are by no means just restricted to children and young people. So these are methods that I think could be available across the board to those beyond the ages of 25.
Oh, thank you.
Yeah. Do you think there needs to be specific training for ethics committees about this type of?
For sure, Selena. I mean, I think ethics committees are pretty awful at allowing research with vulnerable groups, full stop. We know that they're extremely risk averse with enabling us to work with even young unaccompanied asylum seekers. The amount of ethical kind of hoops we had to jump through was ridiculous, but the upshot of that is that people just don't tend to do this kind of sensitive research with particularly vulnerable groups because they're too vulnerable, so we never hear their voices. And so we really have to push back against that as being unethical in and of itself to not allow us to do this kind of research. But we need to go beyond issues of consent and confidentiality and all of those bog standard ethical issues and think about engaging with, other disciplines and good trauma-informed approaches and move beyond the kind of research community as well to the practice community and think much more seriously about how we're conducting this research.
I think that's a really good note to end on, and that means that we end on time. I think there's quite a few people that did have potentially other questions for you, Helen, and that want to be in contact with you in the chat.
I'm just
I'll be having more.
Helen, I'll send you the chat later.
Oh, brilliant. I've just put my email address in there. So everyone, I've got so many questions for others as well. So yeah, it'd be great to have those slides and a copy of everything.
We will be sharing the recording on our main webpage as well for those who still want to kind of get access to the details of individuals as well who've been part of this Seldom Heard Forum. And Selena, I would like to thank everyone really for joining us. All our speakers, Victor, Ramadan, Leila, Emma, and Helen. You've been amazing, and Simon as well. Definitely the lived experience. I mean, how the great amount of insight, and definitely I think that we should do a follow-up after this to kind of continue those conversations from this group. So thank you so much, everyone. Nahid as well, thank you for facilitating that with Simon as well. She's amazing. Keith has got his 2 thumbs up, which is brilliant, so I'm glad. So yeah, I do thank everyone, and we did wanted to have more room for question time, but please do access our NHS Futures webpage. We anticipate that that is used for further conversations, so it allows you to still communicate with people who've attended the forum. So Selena, I think that we'll be sending that following this session.
Yeah, and if you want to put in the feedback, if people would like to maybe have a smaller group discussion about what we've talked about today and facilitating research with communities and ethics and trauma informed approaches, I think that would be really great. So watch this space. Thanks everyone for attending. Have a great afternoon. Thanks Ruth for organising everything as usual. Thank you so much. Yep. And take care everyone.
Thank you.
Thank you, Shama, Selena, everybody, the team.
Thank you, Victor.
Very much.
Thank you, Victor.
Without you, we can't succeed. Thank you. We salute you. Thank you very much.
Thank you, Victor.